What causes people to change? That's an important question for everyone in social work. When we're trying to help, as professionals or as peer supporters, we need to know as much about this topic as we can. In this video, you'll learn 3 prominent agents of change and explore motivators that help create change. You'll learn about the importance of support and planning for individuals with mental health and substance use conditions. This helps change behaviors stick and become long-term progress toward individual wellness. I'm Dr. Richard Hoefer from the University of Texas at Arlington's School of Social Work. With strong support from the Hogg Foundation for Mental Health, I'm presenting information to help you learn more about the recovery approach to treatment. The purpose of this training is to advance the goal of the Hogg Foundation Recovery to Practice Grant Program. We seek to enhance the implementation of recovery-oriented practice among behavioral health practitioners through participation in comprehensive, discipline-specific training, including for social workers. This information will be helpful to anyone interested in learning about the recovery approach to improving mental health services, whether they are still students or are experienced practitioners. When you've made a change in the past, how did you do it? What was the big motivator? For many people, the thing that moves us to change is the sense of dissatisfaction with what we have. People rarely put forth the effort it takes to change when we believe things are just fine. We need something or someone to create the awareness of our own dissatisfaction. Yes, I know this sounds pretty bleak. Still, even when we know we're not at our best, some beliefs can block us from realizing our unhappiness. Lack of knowledge and lack of belief in ourselves are 2 common beliefs that block change efforts. Mental health services and peer support can help us break through these beliefs. We may not know there are better options available to us, and we may not believe that we have what it takes to do the hard work of change. We may not believe the outcome of our efforts to create change will be positive. We may also lack the support we need to create the change and therefore believe it is unattainable. These beliefs create barriers to change. A very natural way for people to start the change process is through social contact with peers in recovery who are successful with similar changes. People with mental health and substance abuse issues can see how well their peers are doing and become dissatisfied with their own lives. This helps them gain hope and see different and better possibilities for themselves. Formal services can provide a big boost for change as well. Hope is a powerful agent of change. Without it, people just won't make much of an effort to alter their life, even if they're dissatisfied with it. Jerome Brutman, in his book Anatomy of Hope, discusses the impact hope has on terminally ill patients. Hope can arrive only when you recognize that there are real options and that you have genuine choices. Hope can flourish only when you believe that what you do can make a difference, that your actions can bring a different future than the present. To have hope, then, is to acquire a belief in your ability to have some control over your circumstances. You are no longer entirely at the mercy of forces outside yourself. This is as true for people with mental health issues and substance abuse problems as it is for the terminally ill patients Brutman writes about. The power of choice is also an agent of change. Providing individuals with choices and treating individuals with respect is helpful in creating change. When options are present in your life, you may choose which one brings you the outcome you want. When formal services treat individuals with mental health and substance use conditions in a respectful manner, individuals develop confidence and empowerment to effectively create positive individual change. When agents of change are activated, so is motivation. Motivation is multidimensional and has been found to involve factors related to both treatment readiness, which is a person's commitment to participate or willingness to receive help, and treatment resistance, the level of confidence in the treatment benefits. Motivation can be internal or external. External motivation may provide a feeling of pressure to change or feeling forced to change. This can be expressed when someone feels as though they're being told what to do, which can leave individuals feeling tired and drained. If the change is internally motivated, then we feel we choose it for ourselves. This change is self-motivated or self-initiated and can create a more satisfying and energizing response when activities of change are required. Highly motivated clients or participants perform activities with greater confidence and commitment. Motivation can also be associated with better treatment engagement, attendance, and retention. We must acknowledge that some individuals with mental health and substance use conditions may experience factors that could negatively affect their motivation. Consistently, 55 to 69% of individuals diagnosed with substance use disorder are also diagnosed with a co-occurring psychological disorder, such as major depression or schizophrenia. Individuals with both mental health and substance use conditions face additional challenges, such as higher rates of relapse, incarceration, violence, hospitalization, homelessness, and increased difficulty in acquiring and maintaining employment. These increased challenges may affect individual motivation and ultimately affect retention and completion of treatment to attain personal wellness. As peer supporters, it is vital for us to use a non-judgmental, strengths-based, and respectful approach with others who are considering a change. While we may view a peer's barriers as minor compared to our own experiences, cultural factors and a history of trauma may make even small steps not so small. Lifestyle changes are often easy to express but difficult to perform. As peer supporters, we draw on our own past lifestyle changes to understand both the barriers and the things that helped us make changes. Our successful experiences from the past can offer hope and encourage peers with support through the process. Planning for change is just one step in the process, but is imperative. Planning is a vital activity in the change process, but even more important is action. Planning for change can be most effective when the plan incorporates small, incremental steps that are attainable and timely. Allowing individuals to attain smaller goals while moving toward a larger, more substantial life change is best. This helps keep individuals internally motivated and energized. Peer supporters can help promote action through a non-judgmental, strengths-based, and respectful approach to support. Support for working on achieving planned goals is a key function of peers and professionals. If change was easy, then people would already do it on their own. In summary, change agents such as dissatisfaction, hope, and the power of choice can help individuals discover a personal need for change. Activities to promote change can target internal motivators, external motivators, or both. They can also activate personal factors that affect the change process. Action is vital to change. Action should be linked to an individualized action plan and non-judgmental peer support. Change is not easy. Still, wellness and recovery practitioners can offer support and an increased prospect for positive outcomes for those with mental health and substance use conditions. This concludes Module 2, What is Wellness? In the next video, you'll begin Module 3 and start learning the effects trauma has on recovery. The next video provides an introduction to what trauma is and how it's identified.